Welcome everyone to this event, delving deeper into gender transformative practice, and thank you for being here today. I'm Misha Barr, I'm the Policy and Health Promotion Manager. Is that too buzzy? Sorry. Is that better?
Yes.
Okay. I'm the Policy and Health Promotion Manager at Women's Health Victoria. It's not better.
Can you hear me? Yes.
Yeah.
Let's do that. So we're really excited to be able to host this event and bring together experienced practitioners in the prevention of violence against women and gender equity to have a deeper conversation about some of the challenging questions and the issues that we're still grappling with in our practice. I'd like to start by acknowledging the traditional custodians of the land we're meeting on today, the people of the Kulin Nation, and pay my respects to their elders past, present and emerging. I extend my respect to Aboriginal and Torres Strait Islander people who are here with us today. I recognise that sovereignty was never ceded and we're the beneficiaries of stolen land and dispossession, which began over 200 years ago and continues today. On behalf of Women's Health Victoria, I'd also like to express our appreciation for the leading work being undertaken by Aboriginal and Torres Strait Islander community-controlled organisations across the country to prevent and reduce violence and to help ensure our communities are safe, equal and respectful for everyone. I hope our panellist, Regina, there you are, won't mind me sharing this anecdote, but when she was corresponding by email with Lyndon about this event, she admitted she doesn't usually get excited about speaking on panels, but was excited about this one. So when even the panellists are excited, you know it's going to be a really interesting conversation. I would also really like to welcome and acknowledge our international guests, Dr. Lorraine Greaves and Dr. Nancy Poole, who've come all the way from Canada to join us here today. Our MC Lyndon will give them a fuller introduction shortly, but I want to acknowledge the groundbreaking work that you've both done and continue to do in expanding our collective thinking about sex, gender, equity and gender transformative practice. You've given us the gift of challenging and pushing our thinking, while at the same time helping us to sit with the discomfort that can arise from some of these difficult conversations, and also making it okay to ask questions and not necessarily have all the answers. You've made an incredible contribution to our thinking and practice at Women's Health Victoria, and we're very grateful to have the opportunity to collaborate with you. We were fortunate actually yesterday to be able to have some amazing conversations about gender, mental health and substance use at our first event with Lorraine and Nancy at Ridges yesterday, and some of you were in the room and able to attest to the breadth of the conversation. It felt like we just scratched the surface of some of the topics we talked about, but I think we started some really good conversations that we will hopefully continue into the future. The panel discussion on gender and mental health was particularly constructive, and we're going to have a recording of that on our website in coming weeks, so I'd encourage anyone who's interested in that to check that out. We're also delighted to have here today Claire Varley, who is one of the co-authors of our knowledge paper that you've all got copies of on your seats. And Claire will say a few words about that paper, and it's been great to be able to capture the insights that Claire and her co-author Steph Rich gained from the research and consultations they did when they were developing our masterclass in gender transformative change, and to be able to pass this knowledge on to others working in the field. So thank you Claire and Steph for all the work you've done putting this paper together, and of course the work you did in developing the masterclass as well. I'd also like to thank VicHealth for your generous support for this event. We wouldn't be here today having this conversation without you. And thank you Shane and Our Watch for also partnering on this event with us and for sharing our excitement and enthusiasm for this conversation. I'm now going to pass over to our MC and Chief Facilitator for the day, Lyndon Deep. Lyndon is Senior Training and Health Promotion Officer at Women's Health Victoria. She is responsible for developing and delivering many of our training and capacity building programs, including our Masterclass series. And she has many years of experience in the field. So I hand you over to Lyndon for the day.
Thank you very much. Thank you, Misha. I will take us through a bit of what today is going to look like, or sort of the basic outline. We'll see what comes together. So we are going to, well, actually, before I go into what's actually happening today, I was talking to Lorraine and Nancy yesterday about the questions that we had today, and and some of the just the ideas about the discussions that we might be able to have together today. And there will be a session where I get to ask them a bunch of questions. And they said, well, we have some questions for you. We'd like to hear about your thoughts from facilitating the masterclass last year. And I thought, oh, I wasn't thinking about that. So they said, well, have a think and maybe take a moment. So just in coming up with today really did come from when Lorraine and Nancy contacted us to say they were coming to Australia at the beginning of December. We thought we could jump on that to delve deeper, delve further into the gender transformative practice work, build on a masterclass, and I thought, let's give this to our masterclass alumni. Let's, that's always, it's nice to have something that if you've taken a particular training, you could build on that and keep coming. So that was sort of this idea of coming around and be able to extend that out to prevention of violence against women practitioners and people sort of working in the gender equity space. We get lots of questions that come into the masterclass. Claire, who's part of the development of the masterclass and working with your sort of expert advisory groups, can sort of definitely speak to that. And so you may have been on that expert advisory group here in the room today on what should be in that masterclass and what can be distilled down. And while I won't go through all the different questions that we have had come to us through that, that sort of people wanting to figure out, am I doing it? Am I doing gender transformative practice? What is it? So hopefully we'll get to the question around to Lorraine and Nancy about how do we measure that a little bit later on today. But from what I got from the master classes and from Lorraine and Nancy's book, Gender Unchained, which is for sale out of the lobby, $20, I highly recommend. It just sort of, I took our work copy and it lived in my my backpack for months until Misha actually ripped it off my desk. I let it loose for a moment and it was taken from me. Is that nothing has to be perfectly gender transformative. I guess like we say, not everything has to be perfectly intersectional, but to find what in your work can be gender transformative. What is gender transformative for that piece? And then always push those boundaries. Find what it is and then where can I push it further? How much further can I go? Versus some kind of perfect checklist, this project is 100% gender transformative in and of itself. As we'll talk about today, what is gender transformative changes over time and with context. So it is really rich and dynamic that way. And that is my sort of key message, my takeaway from our masterclass that I try and instill within. But within the masterclass, so we spend the morning of the masterclass, for those of you who haven't got a chance to attend yet, is we talk about what is gender transformative practice and how to build our intersectional gender transformative practice within that. And then we go on looking at men and masculinities, how to engage men and think about gender transformative masculinities, and then what might be some of the challenges that come up with that. And the final part of the day is around self-care, practitioner care, and how to build that in within our work and within our practice, and what that means when we're doing gender transformative work. So that's sort of that little summary of today. So while we are not going into self-care and practitioner care today, we will be touching on the other two. So that's going to start with our panel discussion on men and masculinities shortly. And so we will have a lovely panel that will be introduced to you, and we're going to be having some questions that are really key to them that's come up in their work. Then we're going to have some lunch. And then we're going to come back together, and that's when I'm going to get a chance to ask Nancy and Lorraine some questions. So we have a little in-conversation piece. In both of those sections, in the panel discussion and in the in-conversation, we'll have a Q&A with the audience, so you're welcome to ask questions. And then we are going to do a kind of World Cafe format of delving deeper into some of conversations that we've had. I have some pre-prepared questions for group discussions around that. But if something burning seems to be coming up for people that's not in that list, we can adapt and change as we go. And then we're going to come together, hear about those discussions, and close off the day. So thank you very much. I'd like to introduce Claire Varley to talk a little bit about our paper that we're launching today that you all have a copy of. Woo!
Thank you, Lyndon. Is everyone able to hear me? I've got a bit of a head cold, so if my voice auto-tunes a bit, apologies. for that. I would also like to start by acknowledging the traditional owners of the land that we're meeting on today and pay respects to elders past and present, and to any Aboriginal or Torres Strait Islanders who might be here today. Very, very excited about today. I think, as a lot of you know, when you're launching something that you worked on yourself, it's a very happy launch. It's something that you're very happy to be able to vigorously throw out to other people, so you don't have to sit and think about it any longer. This paper's been quite a long time coming. As Lyndon said, it was developed through pre-com violence funding, in addition to a number of masterclasses that Steph Rich and myself developed in Women's Health Gig over the past, I guess, 18 months now. And I guess in order to put it together, it was quite a consultative process. As Lyndon said, we engaged a whole lot of different people. We did literature review, we had a number of content advisors, we had a number of intersectional advisors and an advisory group. And I do just want to acknowledge a number of the people who contributed to the paper, including Dr. Michael Flood, Dr. Philomena Horsley, Lauren Days, Bianca Evans, Jane Tawney, Vanessa Vaughan, Nadine Head, Kate Diamond Keith and Alan Thompson. And we also, I guess, were lucky enough to be able to pilot the Gender Transformative Practice Masterclass a number of times to help us really get a sense of what were the kinds of things that we wanted to put in this paper in order to actually make it really practical, because that was what we wanted to do. We wanted to produce something that I guess would take some of these conceptual ideas and thinking and make it really practical for practitioners, for when we sit down at our desk and we need to work out what does gender transformative practice actually look like for me in my work, and what are the signposts that I might be doing it, or what are the points that I can check in to continue to reflect on how I might make my work or my organisation more transformative. And look, between us, we really didn't know how complicated this would be. We thought it would be quite an easy walk in the park. We'd ask some questions, we'd do a bit of research and we'd put something together. And what we actually found was that we were quite certain at one point that this had broken us. That, you know, we were taking these really conceptual ideas and trying to work out what this actually looked like in a world that was complex and dynamic and contextual, and where gender intersects constantly with other forms of privilege and oppression. And as we all know, the longer you actually work on something, the less certain you often become of what it is or what you're doing, and the nature of dealing with complexity in the world. And, you know, we found ourselves stood before a whiteboard over many days asking questions like, what is gender? What is transformative? Who are we? Why does the sun shine? What is the meaning of life? So we went quite deep, and we were supported along the way by lots of really clever people in the sector who we could bounce back ideas around. How do we take these conceptual things and actually bring them back to a practice level? So through both this paper and the complementary masterclass, what we really attempted to do is to distill some of these conceptual ideas into something that is practical and helpful, but that doesn't shirk away from the fact that real gender transformative practice is necessarily complex and requires constant critical reflection and the ability of practitioners to pivot or reframe our approach as we go. As Nancy and Lorraine have stated in their work, gender transformation is possible in any context, from the most repressive to the most progressive. And what this looks like is entirely dependent on the context within which you're working. While it's impossible to provide a step-by-step guide, what we have attempted to do is to provide a map of sorts to help practitioners through this. So on behalf of Steph, myself and Women's Health Victoria, we are absolutely delighted to launch this paper into the world of complex social change, and we hope that it helps you as practitioners to better navigate this complexity. So we just need to, we're going to bring out the doves and the giant scissors and the magnum of champagne, and we will officially launch this paper into the world.
Thank you, Claire. What I didn't say about today, which I wanted to mention, which is also sort of is Nancy and Lorraine put to me, is why? Why are we having these conversations? Why are we asking these really complex questions? And my answer to them is that we are practitioners in this room, And we are really busy, and we often don't get a lot of time to think and have conversations. And one of the nicest parts about the masterclass that I see as a facilitator of it is to hold space for people to have those conversations, to have a whole day, which sometimes can feel incredibly luxurious, to push some intellectual thinking, and that it relates directly to our work, and having that time that's not immersed in log frames and deadlines and the email box you can't possibly get through, and those kinds of pieces. So that's a bit more of what today is a chance to have a bit of fun. Hopefully the brain will hurt a little bit. Maybe it won't, but sometimes engaging. So some of these discussions are like, whoa, and we're not going to solve all the world problems today, but it can be fun to ask those questions and sort of dabble in that.